The glucose monitoring devices allow us to quickly measure patient blood glucose at the bedside rather than sending it to the lab, which could take several minutes, up to maybe about 45 minutes. So these devices can report back results in as little as 5 seconds, maybe 15 seconds. Nurses are the primary users of these devices, albeit there are glucose meters that can be used at home by home users for diabetes control. But the nurses are the primary users here, where they collect the blood sample and dose the device and report the results and act upon those results as needed. Many studies all the way back to 2000 have found, including those done by our team, have found that drugs such as vitamin C, as well as what components make up the blood, actually impact the accuracy of these devices. And one example would be hematocrit, the amount of red blood cells we have in the actual patient sample. If there's too much hematocrit, it actually blocks the sensor from reading the glucose. If there's too little hematocrit in patients who are anemic, for example, too much glucose can diffuse to the sensor and lead to very high, abnormally high, or incorrectly high results. And that can impact patient care potentially in a very adverse way. So we came about over the course of the past couple of years finding that glucose testing in burn patients is actually very important. It's been known that if we keep a patient's blood glucose within a normal range, especially those that are very sick, such as burn patients, they tend to do better. However, another study came out in 2009 reporting that if we were to keep glucose very tightly controlled by continuous administration of insulin and changing the insulin dose based on these glucose measurements, these patients actually did worse. And this led us to believe that there's a technological component playing a role in this potential risk to these patients. So if the glucose meters were not accurate, the insulin dosing would be inaccurate, leading to adverse outcomes in these patients. So we came about to prove this by bringing in our current glucose meter at UC Davis and comparing it to a newer device that can correct for these interferences and potentially have more accurate results. And we hoped to see if there's an improvement in a patient's glucose control with these better devices. These patients with the better glucose meter, again, the ones that correct for interfering substances, was significantly more accurate. It's actually almost comparable to our laboratory. And on top of that, it reduced the frequency of hypoglycemia, that is severely low blood glucose over the course of time. And it also reduced the variability, the ups and downs that occur over the course of a patient stay in their glucose. The variability of this glucose was significantly reduced, and it's been shown that the reduction of glycemic variability also helps with a patient's chances for survival. One of the things that came about was, how do we address the use of vitamin C and laboratory testing in general? And we came up with a very wonderful system in collaboration with our clinical laboratory scientists, and came up with a system to allow the burn team to be able to test plasma glucose samples very quickly to enable them to not have to worry about these vitamin C interferences, but at the same time take advantage of the very, very accurate clinical laboratory system we have here at the UC Davis Medical Center. Past studies have shown that tight glucose control in this case greatly benefits those that have surgery, wounds, and so forth. Other patient populations may also benefit, including those that have diabetes. But burns and trauma patients and so forth appear to benefit the most. Other patients, it's still to be determined, and this is still an ongoing effort to figure out what's the best way to maintain glucose control in these critically ill patients.